like we're rocking and rolling. So, hi everybody. Welcome to our last education event of the semester. It's crazy. Spring semester has flown by. We saved the best for last. We have a phenomenal speaker and presentation ahead of us. So today, the ACHE Central Florida Student Associates are presenting our event, A Day in the Life of a Hospital CEO. We have the incredible Maggie Bonko here with us today, and we're going to learn what it's like to be a hospital CEO and talk about some key metrics and the day-to-day life. And it's going to be a little more interactive, so definitely feel free to chime in at certain points. I know as Maggie moves through, there's going to be a couple questions for us. And so with that, I won't delay us any further. We'll go ahead and get started. I'll stop screen sharing and pass it over to Maggie.
Thank you, Caitlin. Let me make sure that we can get all this good stuff up and going for you all. Can you all see my screen at all?
We can.
Okay, awesome. Then let's make this big enough so you don't have to see all the preview stuff. All right. Well, first and foremost, as I was saying as you guys were jumping on, huge thank you to Caitlin. It is an honor for you guys to select to hear from me. I'm truly, truly honored. So I hope this will be an enjoyable hour we spend together this evening, and we'll get started. So I always think it's kind of good for you to know a little bit about the person as well as what I do professionally. So this is sort of my life on a one-page slide. I'm Maggie Mbonko, and what you see on your far left-hand side would be not only awkward family photos from the 70s, but the people responsible for me being here. So in addition to Shannon Ellswick, you can also blame that group of folks, and clearly blame them for this weird pink dress that I have on. But I was born in a very small town in southeastern Kentucky called Harlan. Graduate of the University of Kentucky, go Cats. So I'm an avid basketball fan as well. If you look over on the far right-hand side, you'll see some things that I'm very passionate about. Health literacy. I think that every individual owes it to themselves, their families, the people that love them, and the people that they love to educate themselves about their health and to stay on top of their numbers, to make those critical appointments with primary care, and really understand what goes on in the world of healthcare. I'm also a huge believer in Habitat for Humanity. If you haven't had an opportunity to volunteer with that organization, I would highly encourage you to, or to certainly find an organization that you're passionate about that helps your community. The thing that I love the most about Habitat for Humanity is that they teach people to fish versus just giving them a fish. And you get to meet homeowners and really be a part of that experience and watching them help themselves into a new home and get some stability in their life, which ultimately leads to better health outcomes. And then I am a trauma survivor. So, being a trauma survivor gives me a very different view into empathy when it comes to patient care and the things that patients expect and the things that are over the top, and really how it is a whole healthcare system, meaning it's the family, it's everything from spiritual care, not just physical care. But probably the most important thing on this slide, other than Orlando Health and the many, many logo changes that I have been through, is those center pictures. So that is my husband, Michael, and without him, nothing would be possible. It's absolutely wonderful. We celebrate 25 years together this year, and that is our fur baby, Byron. He is our angry 13-year-old teenage cat. So hello to Byron. And then we love to travel in our free time. So that's a little bit about me. So you kind of get a holistic view of maybe thinking through some of the ways that I come at things. So I have two questions for you all to make sure that I am able to best serve you during this time. So the first question I want to ask of the two are, if you were writing a job description for a hospital president, what aspects would you include? What aspects would be paramount to this position?
Compassion would be an aspect.
Compassion, great.
I'd say the
Oh,
number one thing that we're learning based off my organization as well as from my master's program at FAU is emotional intelligence. So anything stimulating on that aspect of it would be a great aspect to include.
great. Great answer. Thank you. Let's go
I
for
see
one more.
Elena put in the chat strong leadership.
Strong leadership. All right, so we'll definitely make sure that during our time together, we talk a little bit about compassion, emotional intelligence, and strong leadership, and look at how those are intertwined and not just, this job is certainly not just numbers, right? So I'm really glad you all brought those three up. And then my second question for this group is, what do you hope to walk away with from our hour together today? When you leave here, what's sort of the one thing that you would think, I feel like I got something from that.
If I would to throw a joke in there, I'll see how fast I can be a CEO as well. I would love to get there. So that's for me.
Okay, great.
I think
Wow.
for me, like we know what the big goals are as far as the job of a CEO, just in general, like what you're responsible for. But
Okay.
getting to see what it's like on a day-to-day basis is, I think, the thing I'm most interested about, on what your Monday through Friday looks like, how you
Mhm.
operate daily. That's important to me to kind of understand.
Okay.
I'd love to kind of just know, what is Orlando Health's vision and how do they plan to get there?
Okay. Awesome. Thank you,
I have one
guys.
more too. Sorry.
Sure. Sure. No,
Um,
jump right in.
what I guess what makes you make that final decision? And like, what is the thought process behind any decision you make? What is that key aspect? Is it more of an intuition? Is it experience or evidence? Like, what can help you make those decisions a lot easier?
Great. Fantastic. Okay. So, how fast can you get to be a CEO? What are those big, audacious goals? And in general, what does it look like on a day to day from my work day and then from operations? And what exactly is OHI's vision and how are we going to get there? And what is the process behind those big decisions? So I've got everything. You guys feel good? Okay. So let's see if we can get to all of those. So I want to start out with a really high level view because I think it's important to understand from a day-to-day aspect what I'm a part of as it relates to Orlando Health because that's a big organization. And then B, what are my primary responsibilities? So what you're looking at is what we would call the regional map of our organization. So you can see that we are broken down into multiple regions. For me specifically, I live in that South Central and Midwest region, and we'll talk through why I'm living in two. I've got a foot in each. So when you look at that, you're looking not only at West Orange County, but you've also got your Four Corners area that has parts of Lake, Osceola, Polk, as well as Orange County. It's a super fast growing area. We saw in Orlando back in the early 2000s where we had a lot of folks moving north into that Volusia County market because you could move there, you could still get good housing at a reasonable cost. Well, as that community grew and developed, individuals realized that now we're going to have to move towards the Southwest. So we're really seeing a huge population boom there. Polk County specifically is the second fastest growing area in the state of Florida. They have about 10,000 people that move there about every 6 months. So if you have a chance to drive through Polk County on your way to the beach or wherever you may be going, you'll see certainly a booming building situation. Some of the other areas, obviously, you're going to have Davenport, Reunion, Winter Garden, Haines City, Lakeland, Windermere. All of that is rolled into those two regions. So for me specifically, I am responsible primarily for Orlando Health Horizon West Hospital and Orlando Health Emergency Room at Reunion Village. That is a freestanding emergency department. So right now, Horizon West has 60 beds open in the tower. We can go to 120 beds. We are getting ready to embark on the building of a second medical pavilion on our campus. We'll talk briefly about that. And then at Reunion Village, and that is about to hit its 2-year anniversary, and we're already starting to talk about expansion there as well as an outpatient footprint. The two areas that you see that are highlighted in black and that are italicized are areas that I am basically interimly responsible for. So we're just closed on property for Lakeland North Freestanding Emergency Department, and that will open in 2025. And then I'm also have oversight for Lakeland Highlands Hospital, which will open in 2026. That is 300-bed facility on about 87 acres of land that has room for 3 medical pavilions, a hotel, and an ASC. The reason that I am involved in those two areas is because for now, one, Reunion sits in Polk County, so close to Lakeland. Two, Lakeland North Freestanding Emergency Department will report to Horizon West prior to the hospital opening. And number three, I know a little bit about building buildings. So until we actually have our admin team selected for that area, I'm really filling that gap for the community. And then anything that needs to be bounced off from an administration perspective around building decisions. So that's sort of my scope of work, if you will. And then we talked a little bit about, or had a question around, what does strong leadership look like? What are those goals? How do you get to them? What are, Orlando Health's plans? So the first thing you do with any sort of goal is you have a mission statement for your organization. And a lot of times people will say, well, the mission statements are just that. It's like that one overarching thing that we want to do. Well, Orlando Health specifically is to improve the health and quality of life of the individuals and communities we serve. So that is actually our true north. What you see on your screen right now are our strategic imperatives to be able to get to that ultimate goal. So wherever we're placing a physician practice, a hospital, an urgent care, a freestanding emergency department, a radiology center, any of those things have got to pass the sniff test of improving the quality and health of that community. Now, the how behind that is going to be these pillars. So the first how is looking at quality. So when you think about what I look at on a daily basis, I'm going to jump up in the morning and I'm going to say, okay, what does my scorecard look like as far as quality and safety? Where's my patient flow? Do I have patients holding in the emergency department? Did we have to transfer patients out last night and why? Was there not a service that was on call? Is it a service that we don't provide? Is it something we need to put on a list to look at? Should we provide it? I'm also going to look monthly to see, have I had any hospital-acquired infections? Because when you have somebody come to the hospital, they're coming to be better than when they came, not to get something when they leave that you or your team gave to them. And then obviously mortalities. You want to always make sure that your observed mortalities are lower than your expected, or you're not identifying those opportunities to rescue patients as they come through your door. I am happy to say for Horizon West, we have had 0 hospital-acquired infections in over 450 days in multiple categories, including C. difficile, CAUTIs, CLABSIs, VAPS, and we just celebrated 1 year and 6 months without a surgical site infection for our team, which is huge. That means we're caring for those patients. All of our team are following the bundles that they have been taught and aseptic technique. So it says a lot about the folks that you're hiring, their attention to your patients, and really how you're driving those quality metrics. Also, be not fooled. Quality metrics come with a cost. So this is also helping you to control those costs around added drug administration, added days away from home that the patient's in your hospital, and then obviously readmissions. If we're doing right by our patients, our readmission rate should also always have a lower observed over and expected, and that really comes through education from your staff. So when you look at those top 3, those I'm going to look at on a monthly basis. I have a meeting that occurs once a month that goes over our quality scorecard. From a patient flow perspective, that is the first thing I look at when I get up in the morning. I want to know how many patients. I want to know ED performance overnight. I want to know if we have any holds. It sets up the day, and I'm going to read the shift reports to see where we at with equipment. And I will tell you that my COO, CNO, and CFO will tell you that I drive them crazy because as you'll see in my typical day, I'm up and going by 5 a.m. The next thing that we look at is earning our physicians' loyalty. If your physicians don't enjoy where they work and you don't make it an easy place for them to practice, you won't have physicians. So we look at operating room metrics really around first case on time starts. So from a surgeon perspective, if you have someone that is not starting on time for whatever reason, be it either the physician is late or your team has not gotten the patient ready, the rest of the day in that room will not run smoothly. You're going to be behind before you ever roll the wheels back into the OR, and it is a huge patient and physician dissatisfier. We also look at our turnaround times in the operating room. So really for an acute care adult hospital, your best in class is going to be 25 minutes. Horizon West averages they average right at 16 minutes. I'm very proud of us. We had like a 9-minute day. Needless to say, the gynecologist that was in there doing the surgery was a very happy camper. And then for your physicians, you're also going to look at workload. So is your physician's practice close to the hospital? If it's not, can you get it closer? Are they covering multiple hospitals, both for emergency department call as well as inpatient consults? If they are, what does that mean for windshield time? Because if they're sitting in their car in traffic, they can't see patients. So you want to make sure that you're also offering that balance of life for your physicians. And then access. There is nothing more frustrating to a physician to say to their patient, hey, we're going to get you in to see someone. Let's use cardiology, for example. I need you to see a cardiologist. We're going to get you in the next week. And the next first available appointment is 4 weeks out. So really earning that physician loyalty is also obviously doing right by your patients, which helps you hit those goals. And then the next thing is our best place to work. You cannot run any business, and certainly not one in healthcare, without an extraordinary team. If anyone tells you that they run a hospital by themselves, they're either crazy or lying. Your team is going to make or break the difference in the experience your patient has, and it's going to make or break the difference in everything else on here. So you're going to look at your turnover. And why are people leaving? Are they leaving because you're having to exit them, because they're not coming to work on time, because they're making life difficult with their other team members? And if that's the case, then you always want to look internally and say, okay, so if we're having a lot of involuntary turnover where we're asking people to leave, then we're not selecting right. So you really need to go back and look at that culture and those values that you're hiring for. If it is because people are voluntarily leaving, it's equally as important. Are we missing something on compensation? Is there a benefit that we're not providing? I look at turnover on a daily basis. This is the second report that I look at when I get up in the morning, is who exited the system overnight and were any of them from any of the areas that I am responsible for and the reasons why. I also receive a trend report each month that tells me the trends we just talked about. That allows me to know what I need to provide to my hiring managers to make them more successful with our teams. Total comp we talked about, incentive. So our team members are incentivized against goals that align with care of our patients. This year, it is an additional $1,000 if we meet our ACHECF scores. So everybody is really working towards that incentive. What I will tell you about incentives is that they are stretch goals. They are not impossible goals. Let's see, since we started doing incentives in 2017 or 18, we've not had a year where we missed our target. So really the team says, okay, give me a goal and I'll not only be there, but I'll beat it. And then best place to work events. Nobody wants to work with grouchy people. So healthcare is stressful enough. And so anywhere where you can insert some fun, whether that's, standing outside at the team member entrance in the morning when they're coming in unannounced with hot coffee and food so that they can either take it home or bring it in with them, whether it's rounding with pet therapy, not just for your patients, but for your team. Or if you're just having a cookout with EMS for team building, there's a lot of different things that you can do around those events that really make work fun. You'll find that in healthcare, you have some leaders that just make an environment where you have to smile regardless of what's going on. And when you do that, you build trust with your team, and they're going to tell you things that you wouldn't have known until maybe something adverse happened to one of your team members, to a patient. They're going to be comfortable coming to you and saying, hey, I didn't feel great about, sort of the tenor of that meeting yesterday. Can we talk about that? It's really building that trust and giving people an environment where they want to come and shine and do their best. Drive growth and innovation. So the question was how we get to our goals. This is the how. So when you look at drive growth and innovation, you're going to look at a lot of stuff. You're going to see volume. You're going to see market share, programmatic growth, again, looking at those work RVUs, the access, and then of course your competition. I look monthly at market share. I look at it quarterly as well. Volume is something that I look at on a weekly basis. If you look at it daily, it will drive you absolutely crazy because it goes up and down like an EKG. So you look at volume on a weekly basis, market share on a monthly and quarterly, and then programmatic growth. You really need to be looking to grow your business. And by growth, I mean have an idea of where you're at today, where you want to be in 6 months, where you're going to be at in 12, 18, so forth and so on. And then you're going to want to build in metrics around those. Your quality metrics that go with programs, your volume, your financial metrics, and then your team member metrics. Who do you need to hire? How do you need to train them? How will you know if they're successful? How will you know if they're happy? So really where the rubber meets the road for a CEO is the drive growth and innovation. This is how you're steering your ship. So you're going to do a lot of work in this space. You're going to be working very closely with your strategy department. You're going to be working very closely with each other in your administration team. You're going to be going out and asking your team for ideas and advice and bouncing things off the wall with them as well. And this is what's really going to help you to grow. And then, of course, if you don't have any money, you can't do any of it, right? So strength and economics. So we get daily what's called a flash report, which gives me a red, green, yellow, so a stoplight report to tell me how I'm doing with net revenue, how I'm doing with procedural volumes, what does my length of stay look like, what do my emergency departments look like, so that very quickly I get an idea of what my revenue is going to be for the end of the month. Am I up? Am I down? If you're watching this daily, it gives you the opportunity to go back to some of these other metrics to say, usually my surgical volume is not down this early in the month. Have we had a holiday? Are there physicians that are on vacation? What do we need to understand to be able to bring that volume back up? And if you've got people on vacation, it's a great opportunity for surgeons who have reached out to you to say, hey, I've got a backlog of cases, call them up. See how quickly you can get those folks through your pre-admission testing process and into your ORs. Month end close. So that is going to be the high level review with David Strong, our CEO for the system, and Leslie Flake, our CFO for the system, to go through each entity's performance. So it's not just hospital, it is very transparent. So you see the medical group, you see all of the institutes, you see the ambulatory services group, and you see the corporate side of the house. So you get an understanding of how everyone is performing and how you can help each other. And then, of course, quarterly adjustments. You have to quarterly look at your financials. How are you performing? Did you lose a physician? Did someone else come into the market? We are hot property for freestanding emergency departments in Central Florida. And so as your competitors build freestanding emergency departments close to you, you start to lose volume from those site emergency departments, ultimately meaning you lose admissions. So you need to be able to adjust to say, I know this freestanding is coming. Here's how we're going to combat that from a programmatic perspective, or we're building our own freestanding somewhere to pull in business. So it's really looking quarterly at what is happening in that market and how you're going to be able to adjust. And then length of stay. Your geometric length of stay, you need to pay very close attention to. That patient flow item that I look at first thing in the morning, if I've got individuals that are staying in the hospital past when they really should be, then we've not served them well, and we're certainly not serving the patient who's waiting in the emergency department well. This is something we've had a huge focus on at Horizon West really since we opened. We are 30% below our geometric length of stay, which means we have patients that come and patients that go, and we maintain a very low readmission rate, and our mortalities are stellar. So I really think that paying attention to that length of stay is also a driver of everything else on this list. We have what's called multidisciplinary rounds every day, and I try very hard if I'm in-house to make those at 10 o'clock. And that is the entire care team, from your inpatient medical group provider to your nurse operations manager, to all the nurses providing care on the floor, physical therapy, care management, you name it, we're there. And the whole goal of that is to say, here's where the patient's at, here's been their care plan since they were admitted with us, here's where we're at in the care plan, and here's what we need today to get them home, either today, tomorrow, or whenever we've deemed that they really should leave the hospital. We have a follow-up call at 3 o'clock, so anything that was pending, be that stress test, be it imaging, labs, all of that can be reviewed at that second call during the day. And then last but not least, and this one echoes back to our mission statement, serve our customers well. Everything we just talked about ends up with serving our customers well. And the one measure that will tell you that is your ACHECF scores. So if somebody would recommend your hospital to a friend or a family, that tells you you're doing exactly what you should be doing. For Horizon West, we are top decile for the last 6 months in our patient experience scores. And that is because we take the time to be empathetic with our patients, to understand them because they're not just a diagnosis, that is a human being in the bed, and to really understand what their needs are and the needs of their family. If you haven't had an opportunity to do extensive rounding on patients, I would highly encourage you that as you go through your career, you make that time to go into those rooms and get to know your patient population and their families. It is really eye-opening in how we can do a lot that is just outside of physical care. So I'm going to pause there before we go to the next slide and just see questions, comments. Is this sort of some of the stuff that you were hoping to see?
Looks like there's some heart clapping, thumbs up emojis.
Okay, thank you. I can't see it. I'm like, okay, either they're asleep or we're doing good. Okay. So next slide. So this is my general day, and I'm going to give you guys examples of today and tomorrow for this week as well, just to kind of talk through this. So I'm up and going by 5 a.m. every day. Most days I'm awake by 4:30. Hop up and do a quick little meditation to set my intention for the day and make sure that I am in a place where I can do the best by the people I work with. I'm going to review those overnight shift reports, current census, procedural volumes, and look at my calendar, all while I drink my coffee and pet Byron. Then I'll check a couple of emails, assuming that I have some time, and usually I'm in the office by 7:30. This time shifts a little bit depending. So for example, Department of Surgery meeting once a month is at 6:30. So there will be some days where this timeline backs up, but from a general day, I'm usually in the office by 7:30. Again, you're looking at emails, voicemails, and then good morning to your team. Always love to round on the team to say good morning. How does your day look? How was your evening? What did you do last night for fun? Are there things that you're concerned about today? And that really gets us all off on a good day, specifically me. I love to see the team and see what they're excited about, either at work or in their personal lives. And then by 8:45, we're into safety huddle. A safety huddle's great. It's all of the departments within the hospital. We come, we review those key metrics about overnight shift reports, current census, volumes for the day. We talk about the patients that we're most concerned about and how we're going to make sure that those concerns from our end are met, whether that's moving them closer to the nurse's station, whether it's they've got a consult, whether it's they need a sitter, whatever the case may be. It's also the place where we celebrate. So it's great to sit in there and listen from safety stories from the past 24 hours or celebrations. And then, as I mentioned, multidisciplinary rounds are at 10 a.m. So if I am in-house, then I attend those to see what the plan looks like for the day for the house. So the rest of my time is spent in a lot of meetings. And some of these are traditional and some of them are not. So some of these meetings are exactly what we talked about. For example, strategy. So Horizon West has just kicked off their full-blown cardiology program. There's a lot of meetings with physicians around interventional coverage, around that program, what it looks like, moving forward, building out second cath lab. So those meetings I'm involved with. We talked a little bit earlier about some of the construction projects. There's a thing called an OAC meeting, which is operations, architecture, and construction. I will jump on those to make sure everything's going as it should be from a timing perspective and to answer any questions that they may need from an operational perspective. Obviously, rounding. And then the big part of this is community. So I am a community hospital, and I will tell you that I would not work in any other kind of facility. There is something incredibly rewarding about being able to be out and talk with members of your community, being a part of those chambers of commerce, being able to see what their needs are, what their expectations are of Orlando Health from a health system perspective. And then being able to answer any of those questions, whether it's uncomfortable or not. It's not always wine and roses and puppy dogs, right? We've had a lot of questions about why does Horizon West not have labor and delivery services? Our average age for that area is 34. And the answer to that is Southlake does. And Southlake is literally less than 15 minutes away. They have a beautiful new tower, and we're partners with them. It is the exact same great care there that you would get if Horizon West had labor and delivery, or that you would get at Winnie Palmer Hospital. So it's really walking people through what that looks like and the whys behind the reasons decisions are made, but it's also opening your doors. So for Horizon West specifically, we have a lot, because it's a new community and it's an emerging community. We don't have a lot of venues where people can gather. So Horizon West has a very large lobby, and we host events there twice a month. Rotary for Horizon West meets there. We've had West Orange Chamber, Hispanic Chamber of Commerce. We had a situation back at the holidays where we had bad weather. There was supposed to be an outdoor concert that was piano, singing, some string quartets with a local middle school. Well, it was supposed to rain and be windy. They had nowhere to put them. Well, they came, and that's what they did at the hospital. We've been able to host, the middle school art show there. And it's also tethering your community to healthcare. So it gives you an opportunity to educate. On Mother's Day this year, we're having a 5K from our parking lot. As a part of that, we're going to feed everybody, but there's also going to be a lot of education there. Education about running and stretching, as well as things like reflux, as well as things like maternal fetal medicine, pediatric care. So all of that's available to our community. So when you ask me what a general day looks like, it starts at 5 a.m. The end is to be determined. So for today, when we get off of our meeting, that today will be my quote unquote end of the day. Tomorrow will start at 5 a.m. and tomorrow will end at 10 p.m. and it will end in Lakeland. So it really depends day to day what is going on as to what the extent of your day looks like. And I think it's very important for everyone to understand that these jobs are 24/7. They don't end on a Friday afternoon. There are many times you're going in on the weekends to round. That also includes Christmas Eve. And you just really need to fall in love with these jobs. If it's not something that's a calling for you, it's a lot of work for something that you're never really going to enjoy in your soul. So my one piece of advice is make sure this is the path you want to go. There are a ton of amazing, rewarding careers in healthcare outside of a hospital CEO, but these are truly jobs that you're called into. And then when you talk about it takes a team. So when you talk about empathy for your team, when you talk about leading with emotional intelligence and compassion, Let me touch on that for a minute. I adore every one of these people in these pictures. And I feel like if there was something that they needed, and I'll give you an example. We had someone in one of these pictures that had a recent event and had to be in the hospital. Their daughter also works in one of our facilities. And so we were able to connect those folks and really follow up. And they were both able to tell me what they needed. And what they needed at that point was to have some family time. So we were able to arrange schedules so that they didn't feel that pressure. And you have to do that. You have to know what your team needs, and you got to have fun with them. You know, they've got to be comfortable with you. The number of people that call me Mags, Magna Doodles, there's a whole lot of things that they call me. Luckily, none of them is hospital president, right? So people, go ahead, I'm sorry. Okay. So people feeling comfortable with you, that's really a huge part of the emotional intelligence. And that only comes from you seeking those people out. Having the courage and the true desire to get to know your team, sit down with them, understand what they find precious, understand why they chose healthcare, what's going on in their lives, where do they want to be in the next 5 years? And it's not just lip service. You truly need to understand how you're going to grow your team. Robin Goldinger, who is our NOM, Nurse Operations Manager at a Reunion Village Freestanding Emergency Department, lives in Lakeland. So, when we started talking about freestanding emergency department there, she came to me and said, "Hey, that is literally 5 minutes from my house. Would that be something that I could be considered for?" And the answer to that is, oh my gosh, and of course. So you've got to know your team down to that level, and you've got to know what they love to do. Today was Chick-fil-A day in our office. I stopped and got it because the admin team has really been putting in a lot of hours. And then, celebrate. There's a lot of celebration on these slides. And if you get the opportunity and your organization gets you a mascot, that's even all the better. The dog's name is Scrubs. He is our mascot. He shows up to all things fun. But this is just a snippet of the team that I work with, and that I am so thankful that they let me come and hang out with them every day. Okay, so this is going to be my last slide before we open it up to questions. I think I'm doing okay on time, but I wanted to kind of give you sort of the top 5 things that I am always asked. So then you'll have those answers. And if there are other more specific things you want to get into, we'll have that time. So the first one is always, how do you achieve work-life balance? And my answer to that is up to you. For me, it's about choices. There are days that the choice is going to be Orlando Health and something that I'm doing there. There are other days that the choice is Michael and Byron. And there are other days that the choice is, I need to step away and do a little bit of self-care so that I can be the best person for all those people mentioned before. So you really have to have an understanding for where your mind is at and how you work as a professional. The last thing you ever want to do is take bad attitude, your own personal problems into your team, or vice versa, bring the issues from work into your home life. So if you can find that balance of knowing when you need to be with both of those folks, as well as sprinkle a little bit of time for you in there, that's how you're going to achieve that balance and be your best you. How do you prioritize? These jobs are nothing if not the ultimate exercise in pivoting. So for me, priority is always going to be around those strategic pillars and around the metrics and the team members that I am ultimately held responsible for. That will in turn lead to great patient care. So whatever is happening today, let's say that I pull up that patient flow report and I'm holding 5 people in the emergency department. That becomes my top priority. Let's say that I've got somebody from the community that's not had a great experience at the hospital. That's going to become a top priority, to talk to that individual, hear what their experience was, and come up with an action plan. So your priorities, while you have those baselines, they will change on a day-to-day basis, which is also one of the best parts of the job. You never have the same day twice. What do I do for fun? Well, I like to read things that aren't healthcare related. So like mysteries, love to be outdoors. So anything outdoors related, I'm going to be there having a great time. And I just really enjoy spending time with my family. And what's the one thing you wish someone would have told you when you first started your career? Two things, not just one, two. They're related. Be incredibly curious and fearless about it. Don't let people's titles get you into title shock. The one thing that I love about everybody that I work with who are in positions that would be considered above my pay grade, if you will, because that term is sadly used a lot, is that they've never told me no. So if I've had a question, including why are we, purchasing and partnering for hospitals in Puerto Rico? Hey, let me get you something on the calendar and we'll sit down and I'll walk you through it. And that appointment comes 2 days later. Always be fearless and curious about what you do, because that is going to get you further and more information than you ever thought you could learn. And then the last thing is, how do you stay up to date on all things healthcare? It's not just healthcare. So you stay up to date on all things healthcare by knowing what's going on in your community. I have to tell you, I can't say enough great things about the American College of Healthcare Executives. When you're looking to understand metrics, when you're looking to compare yourself to other people, whether it's in the state or outside of the state, you want to talk about resource, you have got it there. I am also a card-carrying member of the Society for Human Resource Management. Yes, go ahead, everybody gasp. But it's a great place to understand World at Work, which is all compensation models as well as benefit models, to really understand what your workforce is looking for. Florida Hospital Association is a great resource. They have absolutely wonderful phone calls, especially when you've got state legislature in session, that talks about the implications to bills that are working through our state. And I really can't say enough about Mary Mayhew and her team, and really would encourage you to be involved there as well. So those are kind of my top 5 frequently most asked questions. And so now it's your turn. And I think I got to most of these, but if I didn't get as in depth if you wanted me to, please feel free to ask questions.
I have a question.
Okay.
So you mentioned kind of like getting to know your staff and everyone around there. What other ways do you use to like connect with the actual the clinical staff to retain them, like you were saying, how to make your physicians happy?
Sure. So one is that I'm like really annoying. I just show up. So, if I know that someone happens to be, I don't know, let's take Dr. Cox. Dr. Cox is going to be there tomorrow and he's going to be doing some total joints. I'm just going to drop in between his cases and check on him, or if it's just a random thing that I see that I know someone likes, I'll snap a picture of it, or I'll send a text just to say, hey, thinking about you. Is everything going okay? Or saw you at the hospital today. How was your day? And it's really that outreach to say, what's new with you? What's going on? And, are there things that I need to address or help, or things that we need to celebrate? So that's how I stay connected with the physicians. I can't say enough about also not shorting your primary care in your area. So just because it's not attached to the hospital doesn't mean it's not a part of your health system. So, we have several primary care practices in West Orange. And so I visit those every other month. I have them on a rotational basis just to answer questions, make sure that their patients are getting in to see our specialists. If there have been emergency department visits, what was the feedback to that team, and really connect them. And then the other thing that we do is 3 times a year, we have physician events. So there's no expectation of those. That's just for them to come, meet each other, talk to us, and to have a good time. They're usually in the spring and fall. Most recently this year, we just did one last week at the New York Beer Project, which is a really cool place over in Winter Garden. And then we have our annual Christmas party that we host at Islesworth. And so again, just a great opportunity to everybody get out, bring your spouse, let's meet, let's talk, let's have a good time.
Okay, thank you.
You're welcome. The other thing to remember before I forget about physicians is they're people too, right? So I
Yeah.
think, I think sometimes people get a little nervous around physicians. They're amazingly smart people, but they are people. And, they want to have those connections and those relationships just as much as your frontline team.
Mhm.
What other questions do you guys have?
I have one. It's a little bit loud. Classes are changing in the building that I'm in, so please excuse the
okay.
noise. When it comes to the job you had before this, like what did it look like with your progression from start of your career to now? What got you into your position currently?
Okay, so right now Shannon is laying on the floor laughing at that question, and I'm about to tell you why. I started at Orlando Health as a nurse recruiter. So I started recruiting nurses for ORMC and progressed through leading that team into human resources director for Dr. Phillips and for Health Central Hospital. And then finally getting back into operations as an administrator at Dr. Phillips and then Dr. Phillips in South Sim. And then went to a chief operating officer position for about 6.5 years at South Seminole Hospital, started the Lake Mary project, and then went through the process and was selected at Horizon West. So that's my career path, which is a little all over the place and snaky, which I think is good because it's been great and I feel like it's served me well. What I did to prepare for this role, I'm going to answer a couple things around that. One is that I took every opportunity that came up to learn about physician relationships, to learn about strategy, and to understand physician comp models that I could possibly get. Those don't generally just fall in your lap, right? You have to seek those things out. You don't just wake up one day and somebody's like, hey, I just wanted to send you an email about the market share for the A County market. So I really took time as a chief operating officer, not only to understand the operations of my building, but also to understand that future forecasting and to understand how we were going to attract physicians. And I think ultimately that has really helped me a lot in my current role and helped me prepare for it. The other thing I will tell you about this role is that I asked my prior boss, Sean Molsberger, who some of you guys may know. I'm like, yeah, I just don't know when it's going to be right to apply for that job. And he laughed and he goes, it's never going to be the right time. He's like, and that's how you know you're stretching yourself. So don't be afraid to make that leap.
That's great. Thank you so much.
You're so welcome.
I'm sorry, but I just have to jump in real quickly because there's a common thread here that I hope people are catching on to. When you talk about HCAPs, it's all about, and Maggie and I found this out at Dr. Phillips, it's all about do the people on your staff, anybody, make a connection with their patient and their families?
Mm-hmm.
And the thing you do to make sure that that happens is you take care of your people, because we're a people business, and principle centered, relationship oriented, outcome driven kind of stuff. Maggie is a people person. She came up through HR, but I say the main job of a CEO is to manage culture.
Mm-hmm.
And when you manage a culture where your people are encouraged and they feel appreciated and they feel good about themselves when they come to work, it drives everything else. So if you can take anything from Maggie's success, think about how she has engaged with people in the community and earned the respect and the love of her staff. And that has given her the opportunity to be the person that she is. Um, I just wish, last thing I'll say, and I'll have to jump off a little early. Last thing I'll say is, I wish back in 1990, when I got my first job as a CEO, I could have been on a call like this and heard someone like Maggie give me advice, because this is awfully cool. And Maggie, we appreciate you more than you know.
Oh, Shannon, thank you so much. Very kind.
That we really do.
Well, I mean, and look at
Let's
these people. How could you not love them and want to connect with them, right? They're awesome.
So it does look like we have about 4 or 5 minutes left Did anyone else have any questions for Maggie while we have this valuable time with her?
Hello, Maggie. I had one quick question for you.
Yes, sir. Let's hear it.
Thank you so much for your time. I really appreciate you coming and meeting with us.
Truly my pleasure.
I kind of wanted to touch on the programmatic growth that you mentioned earlier. And I was just wondering, what are some programs or initiatives that you may have worked on recently that
Sure.
have been like strategic responses?
Sure, that's a fabulous question. And that's probably one of my favorite things that I do is strategy. So this is a little bit of a long answer, but I promise I won't let it take up the 3 or 4 minutes we have left. So when I got to Horizon West started out as a freestanding emergency department in 2018, way ahead of population growth. So pretty cool, right? To put a stake in the ground and wait for people to grow up around you. So you're truly growing with your community. The acute care tower opened in 2021. And what were we in the middle of in January of 2021? COVID. So when the tower opened, it was opened with really the idea of let's get through COVID and then we'll worry about the program on the backside. That's where I came on board about 1.5 years ago. So when you look at the cost of acute care, you have to have certain service lines that are at least in their infancy to be able to meet the need of your community and your emergency department. The first and foremost is a general surgery program that you have 24/7 general surgery coverage for your emergency departments. So think appendectomies, think hot gallbladders that need to come out, small bowel blockage, those types of things that are very acute. As a part of that, on the elective side, you need to be able to look for things like complex hernias, more foregut work, that then is not only allowing that surgeon to build the inpatient volume from the emergency department, but also their elective book of business. Ultimately, you reach more people that way. It also is a good revenue stream, and your doctor's going to be happy because he's going to meet all of his work RVUs. So that's one example. We've done that. We've also done something very similar for urology, something very similar around thoracics, things that are similar with GI and GYN. So we've got now full programs, full coverage for the emergency department and those inpatient needs. So then the next thing is, what programmatically does your community seek out? Cardiology is always going to be sought out, whether you are unfortunately 10 years old or 80 years old. So we really started with a good footprint of medical cardiology. We just most recently, Dr. Shash started with us in January to grow that diagnostic cath volume. We have done that. We will apply for percutaneous intervention with ACHA in August. We will then start secondary build out of the secondary lab, and then that will support STEMI services in really summer of 2025. So that's one programmatic response. The other one I will tell you about is a little different. So the medical office pavilion that we are in the process of building, site fitting, all that good stuff. That is going to house something that is going to be very unique for our community in the 8-county market, and that is a pelvic floor institute. And that will touch 1 in 4 people will need those services, and it's not just surgical based. It's also physical therapy. There is a psychology component to that, and it is one of those 4 people that come in is going to be male. So there's also a male health component. As a part of pelvic floor, you also have what's called spin-off services, and those are general surgery, cardiac, colorectal surgery, GI. Those types of things will also be co-located in that building. We're also looking with the men's health services to look at prostate health and infertility. So that answers a lot of the questions for our community. Once that is open, it allows us to decant the current medical office pavilion that's a part of the campus now. Once those practices move into the new building, we can then build back in with pediatric specialty care and maternal fetal medicine. Pediatric specialty care is a strategic response because 30% of my emergency department volume is pediatrics. So those are a couple of examples of things that we have done from a strategic response perspective. If you're ever super bored and want to look at a really gnarly performa, let me know. You're welcome to come out and I will go through the 22-page performa for that building. But it was a really cool thing to do, and I'm really excited to get it going for the community. Did I answer your question?
That definitely does. And I actually might take you up on that 22-page pro forma if
Well,
you're
you know
being
where to find me.
serious.
You know where to find me.
Absolutely. I'd love to
I
reach out
mean,
about that.
we'll get you on my schedule. You can come out. We'll go through it. We'll pull my CFO in. She's amazing and lovely in every way, and she can work through all that with you. It's pretty cool.
Perfect. Thank you for that.
You're welcome. There was one question about how fast can I get to be a CEO? And so here's what I will say. Remember that no time is a good time and you're never going to know? That's going to be my answer to that question. The other part of that is learn every stinking thing you can, right? Because your team is going to come to you with questions and you want to at least have a basis for an answer, just knowing you're never going to know everything. But really just soak up every bit of information you can get. And that's what I mean about be fearless and curious. It'll get you there quicker.
I have a question if we have
Yeah.
time for one more. So I was actually shadowing in the OR today, and I guess my question would just be, what's like the best, or how do you feel like is the best way to empower physicians to do more than just kind of utilize their technical skills and abilities to kind of get
Sure.
them to think and like go beyond that?
Well, so I think it starts, so one, I'm in a unique position right now, right? Because I get to hire the physicians that align with my culture. And what I will tell you is that my intensivist, my lead intensivist, my lead hospitalist, and my director of the OR and I interview everyone from a physician perspective that applies for a job at Horizon West. And if one of us votes no, they don't get hired. So that's first and foremost is that cultural piece. Because then if you've got the cultural fit, that engagement is easy. Now, let's talk about South Seminole. So we inherited South Seminole from a different organization, and with some of that came physicians that had been there for an extensive period of time. Sometimes that's good, but sometimes it can also be problematic because when you go to a physician and say, hey, I know you put in 14 hours today, but would really like you to be at this meeting tonight, they're going to look at you like you've lost your mind. So you've got to figure out what makes it important to them. So for example, the director of the OR at South Seminole Hospital was a urologist who has practiced there for probably 30 plus years. He had been through, I think I was probably the 100th person that OR had reported to since he had worked there. So it really started with saying, okay, Dr. Brooks, what is your most frustrating thing? What thing absolutely drives you crazy about this OR? And he'd tell me, and I'd remove that barrier. And it was like, whoa. So we went through about 5 iterations of me removing barriers for him. And as a part of that, we were building a relationship along the way. And so that allowed me, after about 9 months, to say to him, I really need your help. We've got people who aren't using their block. We've got people who are not doing what they should be doing with their post-op note. You're really my lead for the OR, and I need you to help me with that. And he looked at me and he's like, I will help you because I know you've helped me. So it's really removing those barriers, showing them that you're their partner. You're not the person coming in there with a stick. That's not your role. Your role is to build that culture and build that partnership for your patients and your team. And so that's really how I engage. Right now, I've got a great director of surgery. He's wonderful as the department chair. It's Dr. Cox. And his vice chair is a hand surgeon. And together, they're just great. We review metrics every month. If we have a surgeon that is not utilizing their block or they're starting their cases late, we'll reach out to them together to say, how can we help? Not, why are you not starting your cases on time? But how can we help? And the more you do that and you include them in those conversations, and then you find out stuff too, right? Like one of the things that I found out was, well, I have a hard time getting started because I go on the same day that the GI docs are there and they're eating up space in the PACU doing their pre-screens for their easy entry patients for their general colonoscopies. Oh, okay. Well, then we need to have more staff so we can open more beds for you that day. That's how you engage them and get them as a part and, get them to be a part of what you're doing. It's removing those barriers. And when they see you do it, they're way more likely to hop on the bandwagon and help you than to be a barrier.
Perfect. Thank you so much. I appreciate it.
You're welcome. I love the OR. My mom retired from OR nursing after 40 years. So I technically grew up in the OR. So it's one of my
That's
favorite
great.
places. Yeah, it's cool. It's a cool place.
Yeah,
And they're
no, it
cool
definitely is.
people. And yeah. There's so much to learn there.
I know we are running a little bit low on time, as Caitlin was mentioning, but I have to ask one more question.
Sure.
So just as us being students, a mixture of a little bit of undergrad and graduate students, what would your advice be for us and next steps that we should take to kind of get into the world that you're in?
Well, you got to get into healthcare somewhere. So if you're not already in internship, an externship, or somehow employed with a health system, do that first. I say health system, practices are great. I mean, all of those things are great. If you're into the insurance side of it and you think that's the route you want to go, get involved there. If you think you want to go the CFO route, get involved with Ernest & Young, right? Or somebody that's doing auditing. But you got to get your foot in the door and you've got to start making those connections. A huge part of my success was that I connected with a lot of people who took an interest in my success. And I did that because I started 19 years ago here. I took every opportunity that was afforded me, even when I really didn't want to go serve ice cream at 3 a.m. But I did it, and I'm so glad I did. And so my advice to you is get involved somewhere and get involved quickly and start making those connections with people who are going to be a part of your work world and your work family. And what you'll find out is you'll end up with some really great people who are raving fans and who want to help you, and who also aren't afraid to course correct you either. And you need that just as much as you need a cheering section sometimes.
I don't even want to jump in and be like, we're at 6:06 because this is just so good.
Listen, if you guys have questions and, Caitlin can certainly get you my contact information, but it's not always like I said, wine, roses, and puppy dogs, right? So if there are things that you run into, or if you have questions and you think it's something I can help with, I am happy to do so. And if I don't know the answer, I'm pretty savvy about finding folks who do. And again, I can't tell you how much resource you've got with this group, with ACHE, Florida Hospital Association, all of those places. So just don't hesitate to reach out and use those resources. You'll be very glad you did.
Thank you so much, Maggie. If
You're
everyone can throw up some little emoji claps or unmute and say thank you. This was
Oh my gosh,
really
you're welcome.
amazing, and we really appreciate your time and all the insight that you gave us. Really invaluable, and we're so lucky to have had you as our speaker.
No, I appreciate you guys. And again, very humbled and honored. So thank you for spending an hour of your time with me. I'm only a text, phone call, or email away if you need something.
Thank you.
You're
Thank
welcome.
Thank you so
Thank
much.
you. Have a great rest of your
Thank you, ma'am.
semester.
Thank you.
Thanks.
Thank you.
Thank
you.
See everyone soon. Thank you.
Bye-bye.